question. Right. So if you have read and understood, considering it surgical pathology station, kindly please tell me, after reading the STEM, what are the differential diagnoses that you'll consider for this particular patient?
Ma'am, I will go with renal cell carcinoma.
All right. Your primary provisional diagnosis. Then what are
Yes,
the
ma'am.
differential diagnoses that you'll consider?
Polycystic kidney
All right. Okay. And
and renal cyst.
okay, right. Now, in order to confirm your diagnosis, what investigations would you ask for?
I will go for a CT kidney ureter bladder, ma'am.
All right. Okay. What else? You've got the patient who has temperature, hemoglobin is really high, and there is a mass. So, what would you consider, and what, please elaborate.
I will go for a complete blood test.
All right.
I will do an LFT. I'll look for a CT chest as well.
Okay.
I will go for an since it is abdomen, I'll do an MRI as well.
All right. Okay. And what would you do to consider
Ma'am,
the second and third, your differential diagnosis?
I'll do an ultrasound, ma'am.
Ultrasound. Okay. All right. Then, yes, what do you expect to see? If we say that renal carcinoma are the most common or the could be the most likely diagnosis, so what type of renal carcinomas are the most common ones?
Adenocarcinomas, ma'am.
Okay. How would you classify renal carcinomas?
Depending upon the histology, ma'am.
Okay. Yes, please tell me.
It could be clear cell carcinoma, papillary, chromophobe, mucinous tubular, spindle medullary carcinomas.
Is there any other method or any other classification criteria that you can use to classify renal carcinomas?
Uh,
Yes.
transitional cell carcinomas, ma'am.
Yes, but is there any other method or any other classification system that you know of?
I'm sorry, ma'am. No.
Okay. What about TNM classification? Can you use it here or not?
Yes, ma'am, we can use, ma'am.
Sorry?
We can use TNM classification, yes, ma'am.
Yes. So if this is the scenario that in front of you, what would be the TNM classification for this patient? Okay. What are the risk factors for the development of renal carcinoma?
Smoking, family
Yes.
history, ma'am,
Yes.
obesity,
Yes.
and um, uh, previous history of dialysis, polycystic kidneys.
Yes. Okay. You said family history. So what are the genes which are involved in the formation of renal carcinomas?
Um, uh, uh, MET, ma'am, proto-oncogene, mutations in MET proto-oncogene,
Yes. Okay.
and
Can you? Yes, please.
and Britt-Hog tube syndrome.
Can you tell
And
me the mode of inheritance of these genes?
I don't know, ma'am.
All right, they are autosomal dominant. Okay,
Okay.
can you tell me the pathogenesis behind the formation of renal tumor? How does it take place?
Because of chronic inflammation,
Yes, then?
and due to because of due to chronic inflammation, the leukocytes and the phagocytic cells, it causes damage in the DNA for the proliferating cells. So, which results in formation of peroxynitrate, which is a mutagenic agent.
Yes.
So, once repeated inflammation causes to produce more amount of peroxynitrate, so which results in alteration in DNA and results in formation of carcinoma.
What is the mode of spread of renal tumors?
Hematological blood through blood.
Okay. So what is the prognosis rate for
Uh,
for the renal tumors?
Ma'am, if it
5
is
years. Yes.
R0, then the survival prognosis is 75. 5 years survival rate is 75%, ma'am.
Okay. So considering this patient, you've diagnosed and you've confirmed that this is renal carcinoma. So what treatment can you offer him?
I'll go for a multidisciplinary treatment. No? I will discuss with the oncologist,
Okay.
and I will do the imaging, and I will stage the cancer,
Okay. Other
and
than, yes. Yes.
depending upon the stage, I will plan for the treatment, ma'am.
What treatment would you offer this patient?
Nephrectomy, ma'am. Either it could be
Okay.
partial nephrectomy or a radical nephrectomy, ma'am.
All right. Who else would you involve other than the oncologist? Who else would you involve in the management of this patient?
Um, Urologist, ma'am.
And maybe hematologist and endocrinologist
Hematologist.
as well, because patient would have to take medications afterwards. So, all right, right. In order to rule out polycystic kidney disease, what would you do?
Ma'am,
Yes, what pathology is associated with polycystic kidney disease? How the pain in renal tumors differs from the pain patient suffers because of polycystic kidney disease. Sorry.
patient with lumbar pain, ma'am.
Yes, lumbar, but how it differs?
I'm sorry, ma'am. I
Okay.
don't know.
All right. Can you tell me, right, last 10 seconds are left. I wanted to, what is the type of malignancy that occurs because of immunosuppression? Nobel went. When a patient with polycystic kidney disease presents, could there be any cyst anywhere else in the body?
Yeah, it could be, ma'am, in the liver.
Yes. And
Most important is brain, ma'am.
the
Brain.
Aneurysm.
aneurysm in brain.
And
Yes.
yes, ma'am. There is aneurysm, yes, ma'am.
Yes. And there could be patient could present with the mitral valve prolapse. So there could even be pancreatic cysts, etc.
Okay.
So these are the conditions. Okay, good. Thank you.